Welcome to the IDEXX Continuing Education Series.
Well, hello and welcome to today's continuing education session in the IDEXX CE series. Today we're going to be talking about microbiology and more specifically leveraging the IDEXX Microbiogram. I guess the things we're going to talk about today in the presentation are why microbiology. We might actually do that now, to be honest. I think, antimicrobial stewardship is so important for us these days. It's so difficult to develop new antibiotics, so we need to, treat the ones appropriately that we have. So that means, not using antimicrobials if we don't need to. If we do need to use them, making sure we use the appropriate drug at the appropriate dose for the appropriate duration. And so if we're talking about bacterial agents, by having a culture and sensitivity, we can determine what we need to treat. We can determine what the best drug is to treat it with. And obviously we should be choosing first line drugs if possible, and then moving to more complicated drugs if we don't have any other alternatives with that. But this is how we're going to keep the antibiotics we've got effective by through good antimicrobial stewardship, and culture and sensitivity is a part of that. Another thing we wanted to talk about today is just to review microbiology at IDEXX and talk about what's the difference of our service at IDEXX compared to other alternatives with that. And then finally, we'll talk about the IDEXX microbiogram and really have a discussion of what it is and how they can be useful to you in clinical practice. I'll talk particularly about urine here with the microbiology. It's important to remember that whilst we have our Centre of Excellence in Brisbane, where we do all the advanced microbiology, urine is plated out at every receiving laboratory. So when that urine sample comes in, if a culture has been requested, it gets plated out and incubated. If there's no growth at 24 hours, that will be reported out as an interim negative, and then there'll be a final report at 48 hours if there's no growth. If there is growth at that 24-hour mark, the culture plate gets sent up to Brisbane, where it then gets further processing, to determine the exact nature of the agent and to do a sensitivity with that. We have, there was a significant investment made in the microbiology laboratory over the last few years, and we have for bacterial identification a MALDI-TOF. So that's a matrix-assisted laser desorption ionization time of flight mass spectrometry. Now, don't worry, there's not going to be an exam at the end of this. We're not going to expect you to remember exactly what that is. But the way this machine works is, a colony of the organism is put on a little stage in the machine. Using a laser, it basically turns it into a gas, and that gas gets biochemically analysed, and that allows us to identify the bacteria very rapidly, and identification to a species level. So compared to what we were doing before with biochemical reactions and things on different agar, we can get a much more detailed description of the bacteria with that. So it's more specific and more accurate than the manual techniques that have been used in the past. IDEXX have a number of these MALDI-TOFs in different laboratories worldwide. So the benefit of that is this ever-increasing veterinary-specific data bank internationally that's been developed through the IDEXX laboratories, so that we can be as specific as possible with the identification of organisms. When it comes to determining the bacterial sensitivities, in the past, the method was the Kirby-Bauer discs. So I'm sure you all probably remember doing this in microbiology at university. So basically what you do is sort of flood a plate with the bacteria that's been cultured, and then you use that sort of round thing that you put down like a stamp, and it puts the discs onto the plate. That is then incubated. And what it does is you are basically looking at the zone of inhibition of growth around that each of the discs. So each of the discs has antibiotics impregnated in it. So there are different sizes of zones of inhibition for different antimicrobials. But by comparing the zone of inhibition, you can determine whether an agent is, whether the bacteria is resistant to a particular agent. So for example, here, if we look at disc A here, you can see the bacteria growing right up to the disc. So obviously the bacteria is resistant to that antibiotic, whereas the ones with bigger zones of inhibition, we compare that to a set size, and we can determine, if that antibiotic is going to be effective or not. Challenge was this took a little bit of time, and there was a little bit of subjectivity with that. So currently in Brisbane, we have a Vitek 2 made by bioMérieux. And with this analyzer, what it does is a bacterial colony gets suspended in fluid, and then there's a card with a sort of little straw on it that goes down into that fluid. That sort of fluid with bacteria in it diffuses into the card. It's got different antimicrobials in it, and we can determine sensitivities based on that, and also include minimum inhibitory concentrations with that as well. One of the advantages is this is significantly faster than the old Kirby-Bauer technique, and it's also more precise. So we can come out and say antibiotics are sensitive, are they intermediate, or are the bacteria resistant to particular agents? Now, one difference with the way we use the Vitek 2 at IDEXX is with the cards with the antimicrobials in it. These are ones that have been specifically developed for IDEXX. So these are veterinary specific antimicrobial panels. So we're really trying to give you the most appropriate information for the species of patient that you're treating with that. So when you get a result back, you will see, for example, with this urine culture here, you'll get a colony count with that, you'll get the identification of the agent, and then it will list the antimicrobials and whether they're sensitive, intermediate, or resistant with that. So that's going to help us guide what we would choose for that particular patient. So moving on to the IDEXX microbiogram. So what the microbiogram is it's sort of an antibiotic surveillance report that you can get for your clinic. So the question is, how do we get a microbiogram? If you've submitted 10 cultures per reporting period, which is period 1 is January to June, period 2 is July to December. If you've submitted 10 cultures through that time, we can, on request, develop a microbiogram for you. So we look at it for urine and ear cultures. So what we determine with that is go back through the data that's come from your clinic to determine what are, let's talk about urine for example, what are the most common isolates that you've had in the urine cultures that you've submitted. And we'll give you, the agents there, sort of, the first up to the first 3 that are most common. And if we've had ear cultures from it as well, we can do the same thing. Then we look at what the sensitivities have been with that. So we can tell you for each of those agents, which have historically been the most effective agents for that particular bacteria, and what has been the agents with the most resistance to it. You will also get data in there of, for the state that you're in, what are the most common isolates and what they're most and least sensitive to. And there's also national data with that as well. So the way we can use this is that it can help us guide empiric therapy while we're waiting on a culture. So I'm not in any way, shape or form suggesting to you that, because you've got your microbiogram, that you don't need to do a culture. Not saying that at all, but this is going to help us guide empiric therapy until we get those urine or ear culture results back. Always keep in mind that if it's a patient with recurrent urinary tract infections, if it's a patient with chronic otitis, getting those culture and sensitivity results is important, but we've also got to direct some of our attention to finding out what the underlying disease is, because with recurrent bacterial cystitis or chronic otitis, there is almost certainly an underlying disease process that is, contributing to these recurrent infections. So, what we're saying is ideally, a culture and sensitivity is really best practice, because by testing first, before we treat them, we can really practice a high level of antimicrobial stewardship with that. When we look at what IDEXX can offer you, we have our Centre of Excellence in Brisbane that brings together that veterinary specific expertise and the technology with the MALDI and the VITEC to really provide you a really high level of microbiology results. They can help us provide it more quickly for you. And that way we can help you guide selecting the most appropriate antibiotic for the longer term therapy with that. But in the short term, while we're awaiting those results, the IDEXX Microbiogram is a way to try and help us guide empiric choices. So, we can talk to the client about, well, we're going to start this medication initially, because if you've done the urinalysis, see pyuria bacteria, and we're comfortable there's likely going to be an infection, we can talk to them about this is going to be our initial choice until we get the culture results back. And, we can explain to the client that, doing that culture is really important for that antimicrobial stewardship, to try and make sure we choose the right drug and minimize the risk of antimicrobial resistance with that. So if you would like to get more information or register to register your clinic for the IDEXX microbiogram in those future reporting periods, you can look here. You can visit www.idexvethub.com/microbiogram. So I hope this has been useful for you today, to just give you some basics about how we do microbiology at IDEXX and the microbiograms. But if you have any questions, please don't hesitate to reach out to us. You can get me through the call centre or on email, and we'll look forward to seeing you in our next CE presentation soon. So thanks for your time.